for any woman who is pregnant. Open mind. Just have an open mind to avoid disappointment. And then thirsty. Oh my goodness.
And you cannot drink anything, can you?
Yes. No. For me, I was like, guys, just give me water. I am dying.
Hello and welcome to yet another episode of Story Morning. My name is Maureen Murray. In this episode, we'll be looking at the second part of caesarean section awareness. Lourdes Walusala, a journalist from Kenya, will be continuing her story about the experiences she went through when she had caesarean section 3 times. In today's episode, I will also be sharing my story about my experiences. Come with me. So my story, my part of what shocked me, for me, in my case, I knew I would go the CS way because I had complications in my body, and they said it was a little bit difficult to have a vaginal birth. So I knew from the word go that I'll have a C-section. I was scared, of course, because when you are preparing to have babies, in your head you think, I'll just give birth vaginally, the normal way. But then when the doctor said you will have a cesarean section, I was shocked, and it took me time to accept it. And then I accepted this. I went online. I downloaded an application that would tell me, how old is the baby, the size of the baby in terms of
yes.
So sometimes as a plum, as a puppy. And so the good thing with this application, it would also tell me that here is a snapshot of how cesarean would be. And I couldn't make myself to watch the whole video, but at some point I think I did. It was scary to see all that blood coming out. And I'm thinking, if all this blood comes out, will I survive? For me, this was scary, thinking about the blood. But so the day comes, it was 39 weeks. Of course, 38 weeks, they try to do that so that the baby will not have turned or have engaged, vaginally. They try to do it at least 2 weeks before the normal 40 weeks. So I go for my C-section early in the morning, around 7. I was already at hospital. At the hospital, we stay there until 9. I'm wheeled into the theater. Yes, my doctor used to tell me about the C-section, but I don't know if there's enough information for you to be told to be prepared enough until you actually go through it.
Yes.
So I'm given the shot, and for me, this is where the numbing shot, injection in the spine, and you're dead downwards, but you're upwards, you can feel everything. I can hear them cutting, I can hear the machines, but I don't feel this gave me anxiety by itself. When the drug is taking effect, the tongue becomes very heavy. You cannot, I couldn't move it, or I don't know, something happened to the tongue, and this increased my anxiety. I told them I cannot feel my tongue, and I think I couldn't swallow. Yes, I couldn't swallow my saliva.
Yes.
I cannot swallow my saliva. Please help me. I'm dying.
Yeah.
You see, even when the doctors tell you about C-section, they don't tell you about these tiny details. You'll not be able to swallow your saliva. The tongue you will feel warm in your body. These small details they don't tell you. That the feeling of not being able to swallow was scary enough. And what else happened? And my husband was there next to me here. They cannot allow him to go to the other side.
Yes.
Because I told him, please record, because I want to see everything. I really wanted to see how they do it. But they did not allow him to record. He was able to record like just 5-10 seconds of when they bring the baby, but on top of the material from that side bringing to me. That's the only part he was able to record. But on the downside, no. We requested, but he said no. It's not possible. I don't think I was prepared about the pain after the surgery. We are in the hospital a few hours later. After the surgery, they take you to a waiting room.
Yeah, the recovery room, yes.
Recovery room. So I was there, and I was okay. But when I went to my room, I felt very cold. I have never felt that kind of cold.
Yeah, actually, and then thirsty. Oh my goodness.
And you cannot drink anything, can you?
Yes. No. For me, I was like, guys, just give me water. I am dying.
I don't know why we only associate all these things with death, but it's horrible. I was feeling cold. I have never felt in my life. This place, sometimes it's winter and it's cold, but I have never felt that cold in my life. It was in my bones. They tried to bring warm things. I was shaking. I couldn't talk. And then they told me, let us bring your baby. This is like maybe 1 hour, 1 hour and a half after the surgery. Let's bring your baby so that you can hold and bond.
Breastfeed,
And I had to admit, I said, no, I cannot. How will I hold him? I'm shaking, and I want to cry because I'm shaking. I cannot control myself. How will I control this tiny little baby when they bring him into my hands? So I kept saying no for like 30, 45 minutes. But eventually I said, okay, bring him. I'll be okay. They have added like 3 blankets on top of me. I cannot feel the warmth. But the best thing happened when they brought the baby. I don't know what happened. The cold.
Yeah.
Weird.
Even the pain, you forget.
I said, why didn't they tell me that if I do this, I will be okay? And
you'll be okay, yeah.
So I felt that cold, and when the baby came, it disappeared. So now let's go to when I go home. I get home and there was so much pain. I cannot lift. I don't know if it's the way I manage pain. Some people feel more pain than others. And well, my mother always used to tell me, but wait. The way you feel pain, how are you going to manage when you give birth? And I never understood what she meant. Because I love my body. I don't like pain.
Yes.
When I cannot even lift my legs from there to put them on top of the bed, it's painful. I cannot lift my baby when I want to, when he cries.
And even just walking.
My first walk.
Yeah.
And then when
and the nurses will insist, no, you have to walk. No, you have to get out of that bed and walk. And you're like, you people, do you know the pain that I'm going through?
Oh, Lord, did they come to press your belly?
Yes.
To remove some clots or blood?
Yes.
Why do they do this?
I don't know.
This was the worst pain ever. The C-section, I mean, even the pain of after the C-section, it's manageable because it's not intense in one go. This pressing of the stomach was horrible. Horrible. And they said, oh, it's going to help you to remove the blood. And I didn't like it. That was really painful.
Yeah.
But generally, that was it. It was just pain. And of course, it comes with lack of sleep afterwards. For me, I didn't have enough milk as suddenly when the baby came.
That is another thing. And they tell you to drink flasks and flasks of warm. They bring you chocolates. They bring you, I don't know what. You have to keep on taking.
Yes.
Yes.
It took me 3-4 days. And even when the milk came, it was not enough. So we had to give him formula this first few days. We continued even after a month. We were still giving him formula because it was not enough. But after 1 month, 1.5 months, it was a lot. A lot of milk. I don't know if it's a lot, but it was enough for him. I would say this was my experience in terms of giving birth up to that point of C-section. But I remember one more thing: bleeding.
Yes.
I didn't think that we would bleed, after the C-section. I thought this was a vaginal. I know the doctors had mentioned, I had seen it on the internet, there's bleeding, but I didn't think it was that much because I didn't, push the baby. So where was this blood
coming from? Yeah.
It was a lot. And one day I was taking a shower. I think because it was warm shower, the blood was too much. I thought I was dying once again. And we had to call my doctor and say, oh, she's worried she's going to die. She's bleeding like a tap, tiny droplets of tap, not stopping for like a minute or two. So I was really scared. But apparently it's normal. But nobody mentioned this.
Nobody mentioned,
Did you have bleeding like this yourself?
Yes, for me I had bleeding, but not so much. no, not so much, but the bleeding was there. And I even asked, where is the bleeding coming from? Because I thought, and they were like, maybe it's the remnants of, yeah, when they remove the baby and then the remnants. So that unless it's a lot of blood, like the one that I had on my second CS, that is something to worry about. But if it's the normal one, on your pad, that one is okay. There are so many things that the doctors do not tell women before they go for CS. Yeah.
You have worked with other women, and have you had any story about a woman who undergone C-section and maybe, I don't know, because they keep saying some people are not treated well when you go through the C-section, you're not seen as a woman enough. Is this thing true? Because, well, for me, I haven't personally experienced it, but have you interviewed or spoken to somebody who has experienced this, was treated differently because they had a C-section birth?
Especially in the, in rural area, they consider you a woman enough. If you go through, you labor and labor and labor and then go and push the baby. But, they're like, these women, and they don't know that there are women who will labor but still go for CS because the labor is not progressing. But if you go through a CS birth, they're like, this one does not even know the pain of giving birth. They bought the baby. They were just given the baby. And you see, for me, I always say CS is even, for lack of a better word, I think it's worse. Because for vaginal birth, you will go through the labor and then immediately the baby comes out, you get the relief.
Yeah.
But for us, the CS people, this is something that it has other underlying effects. Apart from just that, I can't just, for example, if I want to have my babies in quick succession, I have to space my kids and space them well so that I can be able to heal, because that is a major, major, major surgery. From the face, you'll think that you are healed, but inside, there are so many things that are still happening inside. To that, sometimes I feel, especially when it is winter, I think my level of the cold that I feel, I even had to buy a heater. Everyone will be like, it's not cold, but for me, I'm feeling this cold, Right. I'm feeling cold inside. No, for me, I'm feeling cold. I have to put the heater on. And for the rest are like, it's fine. And then remember also after that, you can't do any heavy lifting. Yes. To date, I can't even do any heavy lifting. Wow. Because, the process, it's still not, you look okay, but it's still not very okay inside there. So when they shun women that have gone through CS, sometimes I feel bad. And sometimes I say, no. You go to the villages and they're like, that one got a baby. But there is always a but. Bruce operation. But the other one, they got and they pushed. Hey, that woman is, I know that woman went to the, or they went to the farm and in the evening, they just went to the hospital and they pushed. Hey, that one is a woman. And the way they'll talk about this vaginal birth, the woman who gave birth vaginally and the woman who gave birth through CS, then you know that, we need to change our attitude. Yeah. It's true.
Is there any difference when you give birth the first time through C-section? Is there any difference in terms of the operation or the healing?
I can say no and yes. Okay, the first time you don't know what to expect. Yeah. You're like, you'll flow with the current for the first time. For the second time, at least you know what to expect. But again, the experience is always different. Yeah. The experience will always be different. Like you see, for me, for the let's say the second and the third, the second one, I did not have the pain management drugs the first few days. So the pain was so much. For the second one, I had the pain management drugs, but again, I developed a clot. So it is still the same operation, but different experiences. You know what to expect. It's like when you're a first-time mother, it's like you are learning on the go. And then when you're a second-time mother, you know that, okay, at least I know what to expect. You go there and hoping that the second time will be easy. And then you find out that the experience is totally different. totally different.
You speak about the clot. Is this also a side effect of C-section, or would you know?
Okay, for me, they said it's a side effect of CS, but again, my doctor said I am prone to having a blood clot. I remember in my first CS, I developed a clot, but on my stomach. And I remember I went to the doctor's office and they opened, actually I missed that point because they opened the wound and they were drawing blood. What? You know, they were drawing blood. Yes, because that blood was here and I was feeling so much pain. So when I went back, I remember they opened that wound and it was like they were drawing blood from that place. So the second time I did not have any clot or any complication. The third time is when I got the clot on my leg. And my doctor said, you're supposed to, anytime you go for any surgery, not just CS, you're supposed to tell your doctor that your blood is prone to clot so that they can inject me with some blood thinners before the surgery. Yes. And you see, that is something that nobody told me. So I was like, This time it was really bad. Even to date, the effect is still there because my legs are not the same size. So I have to go every year I have to go to the hospital and they just do some tests and then I have to keep on walking. I have to keep walking because sometimes you sit down for long. When you want to stand up, you feel it's like an enhanced muscle pull. It's like an enhanced muscle. You feel it is a pain that is on another level. It's muscle pull, but again, muscle pull with some pain. Wow. So I have to keep on moving. That one also will affect my next pregnancy because I was told now because of the clot, then it means when I get pregnant, I have to be on blood thinners for 9 months. You see, now you are like, is it really worth it? Okay, see, I have 2 kids, so it's a boy and a girl. Yeah. Do I really want to go through that? Because and those will be injectables. So you are like, I will be injecting myself every day for 9 months. Why? Yeah. I'm like, no, I don't think no. And then I go through CS again, and then I go through again. It's in the middle of the night. The baby is crying. Your wound is paining, but again you have to wake up and breastfeed, and then mothers have a special place in heaven. What?
I think so too, and I think so too. Also, there's this part where because once you give birth through C-section, I'm not sure about the vaginal birth, but they put a lot of painkillers, which comes with water, right? In water. Yes. So this water is retained in your body. For me, it came the after effects was swelling. I was so swollen. My face, my lips, my legs. Yeah. Oh, my legs. My legs were horrible. I couldn't fit in any shoes I was wearing. Even when I'm going to the clinic, I was wearing these sandals because it was very swollen. Did you have the same effect?
Yeah, I also had a lot of swelling.
What did you do to reduce the swelling?
Okay, the swelling, I was told it will go by its own. And you know, sometimes you really don't know is it the swelling because of the water that I have retained, or is it that I have added weight? But again, it is not swelling because of the weight. It is, you know, you press it like this and you feel this swelling is not
normal. Yes.
You're like, I don't know, that will be like, it will go by itself. You know, you have retained, you just take a lot of water, a lot of fluids, and then you will go to the toilet and it will come out.
Yeah. For me, I spoke to one lady who had gone through C-section and she said, oh, just go to the pharmacy and ask for compression socks. I wore these socks for 3, 4, 5 days and the swelling went down and I was really, really happy. Lords, is there anything that you have had spoken to women and they have mentioned about C-section? What should we do as women who have gone through C-section, or just as women to spread word about, you know, just accept these women as they are, because some of us don't choose, and even if we choose, we should be accepted.
I always tell, just the way you have said it, you don't choose. And even, okay, there are those who choose to. They're like me, pain, laboring, But also there are those who don't choose. First of all, for any woman who is pregnant. Open mind. Just have an open mind to avoid disappointments. Because you will go there. There was a time I was doing a story in Turukara. this woman came and she was really in labor. She was in pain, and she was going to the theater. So they were wheeling her to the theater. I was like, oh, double pain. As in, you are in so much pain, you are in labor, but again, they are wheeling you to the theater because you are a previous CS mom.
Right.
So we follow her to the theater. I was like, I really want to do this story. I follow her to the theater. And at the theater, they say, okay, you can't go beyond here. You can go and wait for that woman in the ward to now go and document her experience after this. Before we reached the ward, the woman gave birth vaginally.
That's good, no?
Yes. That is good. And you see now, open mind, because this woman was like, you guys, I'm in so much pain. Just take me to, just go and remove this. I just want this baby out. And they were willing her, and she was in so much pain. So for her, she was like, the only thing that will save me is that theater. But no, when she was in that theater, they were preparing to do everything for her. She gave birth there vaginally. Imagine, without complication, and she was a previous CS mom. So sometimes you never know. You can start with vagina, and in the next one end up with CS. You can even have 10 babies or 5 babies. You have 4 of them vaginally and 1 through CS. Does it make the 4 more babies than the one that you had through CS? No, they are all babies. So open mind. Whichever way you get your baby, the ultimate goal should be a healthy baby. Because it's not funny getting out of that hospital without your baby, or without even your baby going home and you remain, because you said, me, it has to be vaginal. There's something called obstructed labor. You might labor and labor and labor and labor, and the baby will be tired, and the baby might even die in your stomach. Or you might even develop fistula because you are like, hey, for me, it has to be, I have to be, to show that I'm that woman. And as long as you get your baby, and you get your baby healthy, you get out of the hospital healthy. And then for service providers, as they have these antenatal classes, they should, sit that woman down and tell them, especially the first time mothers, tell them there is this option and there is this option. No option is better than the other. You can go through this because of 1, 2, 3, 4. You can also choose because of 1, 2, 3. There are even those who go through vaginal birth, but they don't tell you that at some point they will inject you so that you labor quickly. And someone is like, what? When they give you that injection, you now feel the mother of all pains. And someone who goes through that pain will be like, in my next pregnancy, I am not even going through that,
Right.
And you're allowed, because you also have body autonomy. You are allowed to, if you have the resources, because also CS birth is not cheap.
Yeah.
Especially if you choose to go, it's not cheap, it's really expensive, And hospital should give you that option also. If you choose to, you can still have CS in our hospital with our doctors, it will be this cheap. Or if you come in and you want to bring your doctors and everybody, you will, they give you the options to choose what fits you. Because also giving birth is it is something so special that is why in even developed countries, they have a birth plan. Right. I want, when I'm giving birth, I want you to sing this song for, you can even bring a band, they sing you have a birth plan, because it's something so special. Imagine you're bringing another life on earth. So it's something so special. And the more comfortable it is, the better. Yeah, the more comfortable it is, the better.
Yeah.
So whether vaginal birth or CS birth, a child is a child. No child is better than the other. They are all children. The ultimate goal is a healthy baby.
It's true. You mentioned something, and I remembered a few friends actually when I was pregnant also. We were in the same journey. for the two of them, it was a shock when they went to the hospital prepared for vaginal birth, and one of them, the baby was very big, so the baby could not come out vaginally, so she underwent surgery. Initially, it was shock and disappointed. And even another one, what happened? Blood pressure, the pressure shoot so high, and of course she had to be rushed also for C-section. So as you're saying, I think mothers, women, and husbands should also be supportive, because you may never know. You might be prepared, you might be healthy, you might have given birth to 10 babies vaginally, and this particular one is not that way. And you should all be accepted. In Malaysia, they have a very, very good system for mothers who have given birth. Because you pay for it, or maybe the government also helps. But once you give birth 1 month, you choose to go to an isolation home or isolation house.
Wow.
You and your husband and your baby. There you are bathed, you are given massage. Can you imagine massages? Oh my goodness.
I'll give birth to 10.
I know. And the baby is taken care of. You're just probably going to feed the baby. They will show you how to wash the baby, how to properly put the breast into the baby's mouth, because these things, even though you read about them, unless you actually do them, you don't pass the exam, if I could say like this. So yeah, so I think we should, or government should be able to have some things like this for women giving birth.
For me, I really had a very nice experience. For the last my last baby, I was like, actually I can give birth every year. For my last birth, I gave birth at the Nairobi hospital. Oh my goodness, the experience was out of this place. First of all, because first I had a very generous maternity cover. The insurance cover for maternity was really generous and it was really good. First of all, they give you an en-suite room, so you're just there with your baby, and then your husband will come and the visitors that you allow. Let me tell you, you have a bell, you just ring that bell, they will come. Most of the time, you're not with the baby, you're there to rest. So they'll be bringing you up your baby. When you just ring that bell, you tell them, take the baby away. They will take the baby. I never washed my baby while in the hospital. Even when you are leaving, they will prepare the baby. They take the baby, they wash the baby, bring them to you, breastfeed. If you feel like want to rest, just ring the bell. They'll come for the baby. You rest. You're the one who will request for the baby. So for me, I could request for my baby frequently. And one nurse was like, there are women here who don't even request for as they're like, let me just rest. But the experience was really nice. It was beautiful. If you can have that experience of, I go somewhere, they just massage me, they bring the baby, I breastfeed the baby, they take the baby away, and I'm just resting. Because again, you will need a lot of rest.
True.
You know, the babies are out, they are confused, they don't know the difference between day and night.
Yeah.
For us, during the day, the baby could sleep. And they will tell you sleep when the baby is sleeping. That is scam, because you can't. And then at night, it's when they are awake. And then you have this wound. And then they tell you don't breastfeed while lying down, because the boobs might chop them. So you have to sit down, and you are like.
When my baby was small, he had acid reflux. And the only way he could sleep is holding him up on my chest this way.
Yes.
And this is how we slept at night.
By the time you wake up, you are so tired.
My legs that were swollen were horrible. My backs, horrible. My back, my hands.
For the first 3 months, my baby was sleeping on her crib.
Right.
But now at some point, even when we went to hospital, and she was a good girl. I just breastfeed her and put her in the cot, and she will sleep. And she was sleeping throughout the night. Then something happened. She developed cough, flu. And I was like, oh, my baby, how can she sleep there and then I'm sleeping here? Let me transfer her to my bed. And that is how I spoiled, what we had built for 3 months, because now she refused. Every time you keep her in her crib, she will and now you have to bring her back. So you are like, But the first 3 months, she was disciplined. You keep her there warm and she will sleep. Okay, it's time for me to feed her. I'll take her, breastfeed, and then back. And then we just undid that because of that flu. And now taking them out from your bed is also another thing that where does yours sleep on his own?
He does. In winter, because of my own, selfish needs.
Insecurity. Yeah.
I said, no, I'm not going to be waking up going to get him. I'll sleep with him next to me. So I just prepared a tiny little thing and put some things on the bed so that he doesn't fall off and I don't sleep on him.
Yes.
And then we sleep with him. But he's really nice. After that, I just put him. The first few, before it was not cold, when we left the hospital, it was November, December. In January, it was very cold. That's when I brought him into our bed. But November, December, he slept in his own crib, a tiny little bed. It was really nice.
Yes.
Now he sleeps on his own bed as well. In this episode, we have learned that pregnant women should be open-minded. You may never know. You could have given birth vaginally in the past, but this particular pregnancy will not go the same way. So every pregnancy is different. Just be open-minded to allow yourself to have a healthy delivery for you and your baby. Thank you so much for continuing to watch us, sharing, subscribing, and also liking. We are really grateful. If you have not subscribed to my channel, please make sure that you do so. Also remember to hit the notification bell below so that you can continue to be updated whenever we release a new video. My name is Maureen Murray and this is Story Molly. Goodbye.